Morning, everybody. I must say this is pretty cool. Thank you for being here to share this incredibly important and wonderful moment with us. I'm John Brumstead. I have the honor to be President and CEO of Fletcher Allen Healthcare and Fletcher Allen Partners. I will have to change my wiring to not say that again. We have many people to thank for getting us to where we are today. Not in the least our dedicated board members, clinical leaders and chairs. Thank you for coming today. Internal leadership teams and hundreds of other employees who have worked very hard over the past 3 years to set us on such a positive course. And I'm really glad and heartened to see so many of you here today, and lots of you sporting the new spiffy vests. It looks great from up here. As always, we owe unending thanks to the literally thousands of providers, doctors, nurses, and others who are dedicated to getting it right every single time with every patient. And this has led to the excellent quality of care that we currently enjoy. We're also joined today by many friends and colleagues from the University of Vermont, including President Tom Sullivan, who's been a much valued partner to me in so many ways since I became CEO 3 years ago. We have Dean Morin of the University of Vermont College of Medicine and Dean Prelock of the College of Nursing and Health Sciences, also here with us. Their support for this change and all that we do has been critical, and I know that I will continue to rely on their leadership and friendship as we grow and improve our network. Our speakers today, Dr. David Schneider is Director of Cardiovascular Services for the network and Professor at the University of Vermont College of Medicine, and Dr. Eric Gauthier is an Associate Professor and Medical Director of Invasive Cardiology for the network and is based at Champlain Valley Physicians Hospital in Plattsburgh. You'll also be hearing from leaders of the Fletcher Allen Partners member hospitals. Judy Tartaglia is President and CEO of Central Vermont Medical Center, and Paul Sands is Chair of the Board of Community Provider, Inc., the parent company of Champlain Valley Physicians Hospital and Elizabethtown Community Hospital. Our organizations have been on a journey over 3 years to become a single entity focused on delivering health care in a better, smarter, and more efficient way. We've gained tremendous strength in doing so to the benefit of our patients and the communities that we serve. Today, we're marking a new era in healthcare for our region. 3 years of close collaboration among these major healthcare providers has resulted in more coordination of patient care than ever before, more access to academic medicine than ever before, and care that is delivered more efficiently than ever before. In recognition that we are now one team working together to deliver high-quality academic medicine throughout the region, Fletcher Allen Partners has a new identity, the University of Vermont Health Network. And Fletcher Allen Healthcare is now officially the University of Vermont Medical Center. Champlain Valley Physicians Hospital, Central Vermont Medical Center, and Elizabethtown Community Hospital will add proudly the University of Vermont Health Network to their names. This is a landmark moment for the partnership, the university, the College of Medicine, and the College of Nursing and Health Sciences. These new identities will help people understand concepts that are not currently well known. That as partners instead of competitors, we're sharing knowledge and resources to provide patients with the best possible care more efficiently And our goal is that whenever they enter the University of Vermont Health Network, patients are going to experience the same high-quality, compassionate care. We believe that this will lead more people to seek care close to home, which is better for them and better for our communities. In short, our new identities will help people understand that the University of Vermont Health Network is providing the best community and academic medicine right where they live. The name change also reflects our vital partnership with the University of Vermont College of Medicine and College of Nursing and Health Sciences. Working closely with Dean Morin and Dean Prelock and all of our committed and talented staff, we've integrated educational excellence and clinical excellence to create one of the top academic medical centers in the country. And we will now be strengthened by underscoring our connection to a leading research university. Since our hospital partnership formed 3 years ago, we've made changes that are benefiting patients every single day. Cardiology patients are getting life-saving care closer to where they live. Stroke patients are benefiting from standardized rehabilitation and better coordination of care. And oh, by the way, along the way, we saved more than $6 million in supply chain expenses, helping us to better manage the costs of delivering care. And others are taking notice. 2 of the 3 bond rating agencies recently raised us into the A status, and the 3rd upgraded the network to a positive outlook. The higher ratings mean we'll save millions of dollars when we borrow money for major projects, but this is also a very meaningful stamp of approval because the rating agencies don't just look at our financial performance. They don't just check the books. They've also examined closely our clinical and operational performance throughout the network, and they really, really liked what they saw. Another sign of our strength is that other hospitals in northern New York and Vermont want to join us. They want to join the University of Vermont Health Network, and we're in discussions to make that happen. In a moment, you'll hear more real-world examples of how we're achieving our mission to provide high-quality academic medicine more efficiently and as close to home as possible. But first, I'd like all of us to hear from my really good friend and colleague, the president of the University of Vermont, Tom Sullivan.
Thank you, John, and good morning, all. You can see we've had quite a program run up here this morning to get ready for this, but one thing that obviously we missed was the email to John. He's not wearing the colors today. John, you've got to wear the University of Vermont colors here.
Send me a tie.
We've got a bookstore for that. We may get you a discount now that you're a full partner. It really is great to be here with all of you and to see this large turnout on such a historic occasion. I first want to express my appreciation and congratulations to so many in this room who were instrumental in making today happen after probably some 30-plus years of conversation. We got it done. We're announcing it today. We should all be in great celebration mood. Thank you all. Thank you all. As John said, today's celebration is meaningful, it's important, and it is transformative in so many ways that we will describe this morning, but more importantly, as we move forward. It recognizes the support and the magnitude, as John said, of a very long-standing relationship between Fletcher Allen and the University of Vermont, and it expands our mutually beneficial relationship to embrace Vermont, the North Country, and far beyond, as our imagination will take us. This vital partnership advances our mission to improve continuously health and the health and well-being of all of the patients that come to this campus. And it really will have a significant, impactful transformation, as I said, on healthcare delivery throughout Vermont, throughout New England, and in the North Country. And this university collaboration and partnership announced today is historic because it's just the beginning of world-class science and medicine and clinical care and patient safety that will set the standard, not only in our region of the country, but nationally. It accomplishes so much. It helps us improve comprehensively our educational healthcare professionals. If you think about it, from the recruitment of medical students, to the recruitment of our residents, to the recruitment of great faculty across our colleges, this is so important as the University of Vermont and our new partner are really a talent magnet for this state, for New England, and as I said, beyond. All the way from the recruitment of those individually important, talented people who will serve our patients in a first-rate way. Delivering the highest quality patient care, and importantly, the safety of all of those patients and their families. Conducting, importantly, breakthrough bench science and clinical protocol practices to make sure that the University of Vermont Health Network and the Medical Center are second to none in our region or in this country. There is no bigger issue on the domestic scene today than healthcare, the important delivery of that healthcare to our patients and their families, and of course the cost containment within that delivery system. And this partnership signals a new opportunity for efficiency and effectiveness in the delivery of healthcare and safety for patients. It also will be heavily engaged in the national scene with regard to health policy and the planning and the assessment of quality care as well as cost containment. We are going to set the national model and be part of and lead the national discussion about health care in this country and cost containment around health care. And the people of Vermont will be the first to be able to benefit from that new partnership. So today's announcements strengthens and is a win for everybody in our community. Collectively, we are the largest and most significant source of good-paying jobs, outstanding research, high-quality medical education, and exceptional clinical care for patients. Speaking on behalf of the University of Vermont and our very large community, I can tell you how proud and grateful we are today to share our name with our great new long-lasting partner. Because today we finally got it done. And today we couldn't be prouder about the new partnership, the new relationship, and how it's going to benefit all of Vermont and well beyond. Thank you very much.
Thank you, President Sullivan. Now we're going to hear from Paul Sands, who's the board chair of Community Partners, Inc.
Thank you, John. When community providers began discussions about bringing our New York hospitals into the system, it raised some eyebrows. A healthcare system that actually reaches across Lake Champlain with Vermont and New York hospitals working together? Really? After all, up till that point, you probably couldn't describe the relationships as collegial or cooperative. Some other words might have come to mind at the time. But despite potential obstacles, we saw opportunities. And one with the strongest potential benefit was the opportunity to affiliate with and become part of an academic medical institution. We've been in the system for 2 years now, and we are already seeing that potential come to life. Thanks to this affiliation, We're making quick progress toward establishing a family medicine residency program that will be based at Plattsburgh's Champlain Valley Physicians Hospital. That residency program will greatly enhance healthcare and improve the medical services available for a rural population in northern New York. You probably know it's sometimes very difficult to recruit and retain physicians in a rural area with a scattered population. A residency program backed by the University of Vermont can be a long-term game changer for Upper New York. That region has an aging population. Our communities will likely need as many as 100 primary care providers within the next 5 years. And the family residency program will enable us to reach that goal. Why do we think that? Statistics show that more than 60% of residents wind up setting up their practices in the communities where they do their residencies. They've established relationships with other docs in the area. They've established relationships with the hospitals. They've established patients, and they've become part of the communities they're serving. So it makes sense for them to stay. And the more physicians that stay, the more others want to stay. This is a train that once it rolls down the tracks in the right direction, cannot be stopped. A couple of weeks ago, we received accreditation as an academic site, which allows Champlain Valley Physicians Hospital to function as a teaching hospital. We expect formal approval for the family medicine residency program next spring, and we're looking forward to welcoming our first class of residents in July of 2016. We're currently recruiting a director for the program, and we've already heard from several outstanding physicians who want to serve on the program's faculty. All of this is possible because we're partners in a health network that's designed and dedicated to providing the best healthcare possible where it is needed most. It's possible because the University of Vermont School of Medicine, the academic leadership, the medical leadership, the physicians, nurses, and staff of all of our hospitals have worked together to make it happen. And that's only one example of the benefits of this network. Serving our communities and patients, improving health care throughout the region, and ensuring the highest standards of care for all. On behalf of the Board of Directors of Community Providers and the leadership of our hospitals, I'm very glad to be here this morning. We're looking forward to starting our family medicine residency program. We're excited about the future of healthcare on both sides of the lake, and we're proud to be partners in the University of Vermont Health Network. Thank you.
Thank you very much, Paul. Next, I'd like to introduce two of our leaders in cardiology who have put tremendous effort into integrating our first service line. These are the folks that really make it happen. They're the ones that really have the greatest impact on how care is delivered in the care of our patients. First, you'll hear from Dr. David Schneider, Director of Cardiovascular Services for the University of Vermont Health Network and Professor at the University of Vermont College of Medicine. And then you'll be followed by Eric Gauthier, an Associate Professor and Medical Director of Invasive Cardiology for the network based at Champlain Valley Physicians Hospital. And to Paul's point, Eric trained with us here at Fellowship in Cardiology, settling close to home. So, David.
Thank you. The University of Vermont really aptly describes our efforts to create a comprehensive network that promotes health for everyone in our region. Our goal is really to provide the right care in the right place for all of our patients. Our highly coordinated network seeks to provide consultative care and non-invasive testing close to home. As care becomes more specialized, we have developed a tiered system to ensure highest quality. Rather than each institution pursuing its own interests, the formation of this network allows us to think as a system and make rational decisions about the allocation of resources. You can characterize this network as a pyramid. For cardiology, the base of the pyramid will be broad, providing non-invasive testing and consultative care close to home. For more specialized care, that will be performed much less frequently. Services will be concentrated in selected locations. Our efforts to integrate cardiovascular services are a good example of how our network functions. My colleague, Dr. Gauthier, will provide an example of how this integration has impacted care in New York. Both Champlain Valley Physicians Hospital and Elizabethtown are key members of our network. A recent case exemplifies our approach and highlights development of a network in Vermont where Central Vermont Medical Center is a member. A patient in Mad River Valley region had a heart attack. The ambulance crew performed an initial evaluation that included electrical tracings of heart activity, so-called an ECG. This ECG was transmitted remotely to our colleagues in the emergency department of Central Vermont Medical Center. They rapidly made a diagnosis. After identifying the problem, they realized that best care for this patient required an emergency procedure to open the blocked vessel. The patient was diverted and transferred directly to the University of Vermont Medical Center. In our institution, the patient was rapidly evaluated, and where the cath lab was actually ready to take the patient, and he was prepared for his procedure. And actually, the numbers here are somewhat astounding. We were able to open that blocked vessel within 16 minutes of his arrival at this institution. And the standard now is becoming first contact, when you first come in contact with medical personnel. And for him, the first contact to opening the vessel was less than an hour. This heart attack easily could have taken his life. The great news is he left 2 days later in pretty good shape. This type of coordinated care is occurring every day in our region. And I'm very proud to say this has led to the University of Vermont Medical Center to remain consistently in the top 5% of the country in our efforts to save lives of patients who experience a heart attack. This example shows the power of a coordinated network. We have important work to do as we continue to develop the network. We will concentrate on the following: quality, a common, transparent process across the network; physician integration, a unified, coordinated group. We will share images between institutions to improve the care of our patients, and will eliminate repetition of studies that are unnecessary. We will provide the right care in the right place. Thank you very much.
Thank you, David. Thank you, John. Good morning. I am Dr. Eric Gauthier. I'm an interventional cardiologist, and I'm the medical director of invasive cardiology at the Champlain Valley Physicians Hospital campus in Plattsburgh, New York, part of our new University of Vermont Health Network. As an interventional cardiologist, I not only treat patients by prescribing medications, but I perform procedures such as coronary stenting that improve blood flow to the heart. These procedures can be used to treat a patient with a heart attack and/or relieve chest pain symptoms. The formation of the University of Vermont Health Network has allowed physicians at Champlain Valley Physicians Hospital campus and those at the University of Vermont Medical Center campus to work together to deliver great care close to home. For the vast majority of patients who live in New York, this means they can have their cardiac testing and treatment in New York State. For those patients who may need more specialized care, the formation of the network has created a wonderful new set of resources benefiting both physician and, most importantly, patient. As a member of this network, I continue to perform the majority of my procedures at Champlain Valley Physicians Hospital campus. For those patients who require more specialized facilities and resources, I now have the opportunity to perform these procedures here at the medical center. A recent case illustrates the value of our integration. A stress test performed on a 57-year-old woman, motorcycle enthusiast, who had been experiencing chest pain for several months, demonstrated that her symptoms were likely being caused by a blockage in a blood vessel that supplies her heart. A heart catheterization procedure performed at the Champlain Valley Physicians Hospital campus in Plattsburgh showed that, in fact, she had a significant blockage of her left main coronary artery, aptly known as the widowmaker artery. Treatment of a blockage in this location with coronary stenting is considered higher risk and should be performed at a center that offers intensified resources and open heart surgery as a backup to my planned procedure. Because of this integration and formation of the network, I was able to seamlessly plan and subsequently perform a successful high-risk coronary stenting procedure on this patient here at the medical center. Having the same physician at both locations was of tremendous relief to the patient, and I'm pleased to report that she was promptly back to enjoying the Adirondacks on her motorcycle. So, as you can see, the University of Vermont Health Network is providing real benefits to patients and physicians alike, and I look forward to closely working with Dr. Schneider and colleagues to improve the health of people in Northern New York. Thank you.
And now my good friend and colleague, Judy Tartaglia, who's president and CEO of Central Vermont Medical Center, she's going to discuss, I believe, how we're working at the network level to lead healthcare reform efforts in the region.
My name is Judy Tartaglia. I'm the CEO of Central Vermont Medical Center. We're located in Berlin. If you don't know where Berlin is, it's right smack in the middle between Montpelier and Barrie. We're licensed for 122 beds, acute care beds, and we have a 150-bed skilled nursing facility. And we serve about 66,000 people in Vermont and Washington County and beyond. So that's who we are. So how has this name change benefited Central Vermont Medical Center and its patients? Well, you know, for me, it'll clearly identify that Central Vermont is a partner with Vermont's only academic medical center and with the University of Vermont, both being exceptional institutions. And we are really proud as a community hospital to be affiliated with both. In the past, the name Fletcher Allen itself didn't really connect us to the University of Vermont at all. It also wasn't obvious that Fletcher Allen was connected to the University of Vermont through its logo or brand design. So all of that is about to change. For CVMC, the primary benefit of our partnership has been greater access to medical specialists such as anesthesiologists, radiologists, and pathologists. We also hope to gain greater access in the future to medical students, nursing students, even residents, and possibly more clinical trials. The strong connection to both the University of Vermont Medical Center and the University of Vermont will enhance and improve access to the services we provide in Central Vermont. And this is the most important change that's happening at Central Vermont in this network. In addition to the clinical benefits, Dr. Brumstead also mentioned that we've been able to save millions of dollars since 2011 through our joint purchasing efforts and through our joint contracting efforts and through sharing administrative services. CVMC's share of that $6 million savings is about $1 million. And that's a lot of money for our size institution. I was going to talk about leadership, and I was going to talk about healthcare reform, but last night I changed my mind. Sorry, Dr. Brumstead. And the reason why is I think that it's obvious that leadership is happening here in this room. It's obvious that we are being led by the leaders of healthcare reform in Vermont. And enough said. I don't have to elaborate on that at all. In summary, we are so very pleased and excited to have a brand new name. We believe this name will represent what we're all about, which is providing the best in academic and community medicine to our respective communities in Vermont and New York. And also providing these services together, not apart, but together in a well-coordinated, unified, cost-effective way. That's what this network is all about. And again, very proud to wear the colors. And Dr. Brunstad, you told me that this badge would never turn around, and it did. Thank you all very much.
I can always count on Judy to keep me on my toes. Somebody snuck in here who I'd like to recognize. Mayor Moreau Weinberger came in. So you've heard from these folks, and you heard from me probably too much. I believe it's clear that our ability to work as a system has ushered in a new era of healthcare for our region. It's also clear our new identities make sense because they reflect who and what we truly are and will help people understand they have access to high-quality academic medicine.